All right, so today I'm going to talk about the GI. So anyone can give me a hint what does GI mean?
GI is mean gastrointestinal.
Perfect. Right. Yeah, so usually in America they usually say GI, that means, you know, the gastrointestinal system. And also I just want to give you a hint about that. So when we talk about like GI doctors, that means the doctors is specialized in this area. Okay, so the GI doctors, that means that the doctors has specialized in stomach and intestine. Okay, and we also go through urinary system. Okay, so I'm going to start it first with the terminology. All right, so I haven't put the suffix, right? Have you ever heard about a suffix? Okay, so I just want to, you guys know that as any time that I just want you to, you know, jot down some your opinion about the word. That's why I didn't give out the full, you know, definition about that. Okay, so just make sure that you take notes on whatever you understand, and then if you have any question, just, you know, raise your hand or speak up so I can explain more about that. All right, so first I'm going to talk about the GI system. So it's going to go through from mouth, right? So we have, I'm sorry. So stomach, all right, mouth. So we have the word, very long word, okay? Stomatoglossitis. So what does it mean? Anyone want to tell me? It's just like a combined, it's a combined word. Okay, so stomach, that means the mouth, right? And glossal, usually I got glossal, it means the tongue. So usually if the and then the suffix is going to be itis. Itis, that means that inflamed. Okay, so we're going to have the combined word. Stomatoglossitis, which is like you got inflammatory in the tongue and the mouth. Okay, and do you know any other word for mouth? If I would just want to say about, you know, the cavity, just a little bit more on that. So we usually call oral cavity. That means, you know, cái khoang miệng. Cavities that mean khoang, and then oral doesn't mean the mouth. Okay, just a little bit hint. And also the next word going to be esophagus. And anyone can tell me what does esophagoscopy mean? I'm sorry, can you say that again?
Okay, I think that in Vietnam is called nội soi thực quản.
Perfect, good. Yes. So scopy, the word scopy, I don't know how to, you know, make our lines in here, but there's the word scopy, that means that you put some like imaging, usually a camera. So esophagoscopy, that means nội soi thực quản. Perfect. Okay. So if you don't know any word, just like mark it out and then write what you understand. It's make you more, you know, it's make it more memorable. Okay. And next word is going to be gastro. That means stomach. Okay. So anyone can explain to me what is stomach mean? Because I got several cases and the kid asked me, what do you mean by saying stomach?
So
stomach, yes.
Stomach. Gastroplasty is you reduce or you cut a part of stomach.
Yes, yes, perfect. So plasty usually means surgery, but in this scenario, gastroplasty, that means that you have a sleeve. We call it a sleeve. So we make it, the stomach go smaller. Okay. But if the patient asking you, I don't know and I don't understand what is stomach mean, because, you know, some of the kids, they don't understand that. So how do you know, explain it to
Nghĩa là
the...
tạo hình dạ dày đúng không ạ? Cho nó nhỏ hơn ạ.
Đúng rồi. Dạ đúng rồi. Nhưng mà còn cái chữ stomach.
I think I can explain to the kid that stomach is a sac can contain food and it have to digest food.
Yes, perfect. Yeah. So just a little bit, you know, details on that, because it's not a lot of people can understand, you know, medical terms that we're talking, right? So it's usually on the right column. We usually use with the doctors, like peer-to-peer review. That means that we talk together with the doctors. But when the patients in the room and we try to explain that, just try to explain in a plain word. Okay, like esophagus. A lot of people didn't understand that, so we can do like food tube, right? And then the next going to be hepato, so liver. We have hepatology. So what does it mean, hepatology?
Hepatology does mean study about the hepat. It's a study about the liver.
Yes. So, sorry. So logy, that means that you specialize or you study specialist about something. So hepatologist, that means cái ngành nghiên cứu về cái gan. Okay. And then the next going to be pancreas. That means tủy. Okay. And pancreatitis, what does it mean?
It means inflammation of pancreas.
Yes. Perfect. This word is very common. So I assume that a lot of patients, they understand what is a pancreas is. But if they asking you about that, how do you explain that to them?
Maybe I can explain for them like pancreas is an organ in your abdominal and it increases insulin to digest the food you take to become the energy to use the daily activities. Maybe.
Okay. I cannot hear you clearly, but I think it's an appropriate answer. So you can say it's just a claim, like GI claim, that, you know, helping you absorb or digest food. Okay. And gallbladder, cholecyst gallbladder. So we have the word cholecystectomy. So anyone else can talk about that? Anyone else?
The suffix ectomy mean cutting out, and cholecyst mean gallbladder. So cholecystectomy means do surgery to removing the gallbladder.
Yes, perfect. So ectomy that means removal. So cholecystectomy, the same. It's going to be remove the gallbladder. All right. It's very specific word, and it usually used peer-to-peers when you have another doctor to talking about, right? So we use those words, but usually when you talk to the patient, you just said to them that we're going to remove your gallbladder. We're not going to say like, we're going to do cholecystectomy. They're not going to understand that, okay? So cholangitis, okay. So this word is very similar to cholecyst, and it's very related to, so just be careful when you put the word in. So anyone can talk about cholangiography? What does it mean?
Cholangiography does mean take a photo of bile duct.
Yes. So you just have a little work on that. So like photography, that means you take a picture. So graphy, that means you want to see something like a picture, right? So cholangiography, that means that you want to see the bile duct in the pictures, something like that. Okay. And then it's just the word you know, the graphy, the ectomy, the itis, and logis. You can use whatever you want to combine the word. Okay. Yeah, somehow you can create a new word too. And next word is very common, right? Colindo. Colindo, common bioduct. I never use that. It's barely use that. Okay. So who know lithiasis mean?
I think lithiasis means the condition of having stone.
Yes, it means stones. Perfect. So can you explain to me that word?
I think this word cholelithiasis means having stone in common bile duct.
Yes, it's cholelithiasis. So that means that you have a you have to break it down the word to say it, right? So cholelithiasis.
Cholelithiasis.
Yes.
Yeah, it's rather long.
Okay.
Yeah.
But again, so those words is just for, you know, doctor speaking to doctors. When you explain it to the patient, don't try to use big words. Okay. So next word is easy, right? Entero. That's mean intestine. So we have enterotomy. What does it mean?
I think it means the anatomy of the intestine.
I'm sorry, say it again. I can hear you.
Anatomy. I mean, this term is enterotomy. Is mean anatomy of intestine.
Anatomy. Okay.
Anatomy.
Yeah. For me, I just understand that tomy, right? Tomy does mean you create an opening, like you make a cut and you open it.
Open.
Okay. So it's just, again, you guys can, you know, take note on that so that you can remember everything. Okay.
Thank you.
Cái này là cắt ruột non đúng không ạ? Là nó cắt hẳn đi. Thế còn cái ostomy là để lại, là mở một cái lỗ mở đúng không?
Mở ra. Yes, mở ra.
Mở. Open.
Em nghĩ cái này là mở thì chứ không phải cắt nữa.
I'm sorry.
Cái đấy nó chỉ là mở thôi, còn nếu mà cắt thì nó sẽ là cái khác, kiểu như trong cái phẫu thuật nó chỉ là một thìa ở trong cái phẫu thuật cắt ruột thôi ạ.
Còn muốn mà mổ mà lấy ra luôn á, là cái chữ ectomy á, hồi nãy có nói đó, là removal, là lấy ra luôn.
Còn cái này nó chỉ là open thôi.
Yes.
We have an ostomy and otomy.
Yes.
That ostomy is the opening and otomy is the cut incision.
Yes. So the next one is easy, right? Everybody familiar with that. It's appendectomy or appendicitis. What does it mean?
Appendicitis does mean inflammation of appendix.
Yes, perfect. Rồi còn cái từ nào mà để lấy đi luôn cái ruột thừa?
Appendectomy.
Yes, appendectomy. That means that you take out a colon. That means colon. And then colonoscopy. Right? Anyone tell me colonoscopy mean?
Yeah, I think colonoscopy means you do endoscopy in your colon.
Okay, so yeah, so I'm not sure about endoscopy in the colon, but like when you say scopy, that means you just put a camera or something that you can see inside, right? So we have esophagoscopy, that means that you want to see the food tube in here, and then colonoscopy, that means you want to see the colon, and you put it like the camera inside that. Is that okay? Is that understood? Okay, good.
Yes.
And proctal. And I barely use this one. Okay. Proctocolectomy. That means that you remove the rectum or the anus. I never used that before. Okay, just put in here for your information. Okay. Any questions about those words? Hello? No? Okay. Okay, so we're gonna move on to urinary system. Okay, that means cơ quan bài tiết nước tiểu. Okay, cysts, that means bladder, but a lot of just don't use the cyst alone, because the cyst alone does mean you have a different meaning of that. Okay, so we have cystocele, có nghĩa là sa bàng quang. Okay, anyone know the word for inflammatory of the bladder?
Is that cystic?
Yes, cystitis. Yes, perfect. So the next word gonna be nephro. That means kidneys. So nephrosis, very interesting word. Okay, so who gonna tell me about a nephrosis?
Ulcers, it means a disease. Nephro, it means kidney.
Yes.
Nephrosis, it means a disease of kidney.
Yes.
Of kidney.
And then nephritis, what does it mean?
Nephritis is inflammation of kidney.
Yes.
And nephrosis, a common disease of kidney, and nephritis, it means inflammation of kidney.
Yes, yes. Inflammatory of the kidneys. Yes, perfect. Yeah, that's fine, because like in when I study about nephritis and then nephrosis, they're a little bit different. Okay, but just know that it's a disease of the kidney. Okay, I just don't want to give you a lot about the details on that. And then pyelo, we have pyelonephritis. So what does it mean? So I usually use pyelonephritis for the inflammatory of the kidneys. Okay, but especially when they have like bacteria in there, and then they cause infection. So we call pyelonephritis. Okay, and then another word that I mentioned before, nephritis. So it kind of a little bit different, but just be aware of that when you want to say infection of the kidney. So usually we use pyelonephritis, not nephritis only. Okay, am I clear? Any other question? Yes.
Can you explain again about nephrosis?
Okay, so usually we say nephrosis, which is the disease of the kidney, and that's it. But more details on that, what kind of disease, right? So I usually use nephrosis if something wrong with the kidney, like you can see the protein inside the urine. There's a lot of protein inside the urine. So nephrosis, that's what it means. But if you see something like blood, right? Blood in the urine. So you cannot say nephrosis. It's usually about hematuria, and then, you know, we call about like nephritis as well, because we're thinking about inflammatories, like inflame, the kidneys got inflamed. It's just a little bit different. And then again, if you're not sure about those words, don't use it. Okay. Okay. And then pyelonephritis is a little bit different too. So very careful when you use this word. Okay. So pyelonephritis, again, when you're thinking about a patient have infection, right? Renal infection, or some pus in there, or you can see some abscess in there, you can call pyelonephritis. Okay. But whenever you detect some like blood or some urine in the, blood or pus or any kind of like protein in the urine, you can say nephrosis. That's just disease of the kidney. Okay.
Excuse me, can you explain when or in which case we should use the nephritis?
So I barely use nephritis though. You can use when you want to talk about, you know, when a patient have, you know, using some, you know, we call nephrotoxin. That means that these medication can harm the kidney and maybe causes some, you know, some disease, some inflame or some inflammatories in the kidney. So we can call it nephritis, but never use that. Okay, it's barely use it. So whenever you want to talk about infection or inflammatory related to infection, bacterial infection or something, that you better use the pyelonephritis. Okay. And anything else that I will try to explain it. So lid, we already talked about that, right? So it's a stone or calculus. That means that just a little bit stone from calcium. Okay. And the urethra. Okay. So what's the different? They have very similar that I want to show you. So we have urethra and urethra. Okay. So what is the difference? Anyone else?
Teacher, yes. Utero is a duct leading from the kidney to the bladder.
Yes.
And urethra is a tube carry urine from bladder outside the body.
Yes. So it's upper and a lower.
And
right?
lower.
So,
Upper
yeah.
and lower.
Yeah, so this is like a bladder. If it's above the ladder, we call urethra. That's meaning from the kidney, right? And then under the bladder is urethra. And then the word algia, that means pain, right? Urethral, that means that you have pain on a urethra. Okay. Any questions about that?
No, please move on.
Okay, so this is the pictures that I will just want to show you where it is like just anatomy of the urinary tract and then the GI tract. Okay, so those work I can go through it. It's an esophagus, it's a food tube. We got liver, we got gallbladder, we got stomach, we got pancreas, we have transverse colon. Transverse, that means it's nằm ngang, transverse colon. Okay, descending, descending colon, that means that it's going down. Okay, ascending colon, that means going up. Okay, and then it's just, you know, named after how the food go. So you're gonna go from the small intestine, right? And you'll go to the ascending colon, and you go through the transverse colon, and it's going down, descending colon. Okay. Appendix, that means ruột thừa, and sigmoid colon and rectum. Any questions about a GI picture?
So session, what does this mean? Session.
I'm sorry.
So
Second. Hồi tràng ạ. Manh tràng.
Circum là manh tràng. Circum.
Cecum. And on the right side, we have some anatomic area about the belly. It's very important because whenever you talk to the patient or you describe the pain or you document your notes, you have to point out where exactly the pain. And there's a two option for you. I usually use the right one, which is right upper quadrant, left upper quadrant, left lower quadrant, and then right lower quadrant. So it's easy for me to, you know, explain to the patient what it is. But if you want to more detail and more specific, especially when you talk to another doctors, like you got a consult to the GI that you need help, so you have to say something more specific. which is the left side. Okay, so it's really up to you how to choose it. I can start with the left one first. It's a right hypochondria region. And then we have epigastric region. And we have left hypochondria regions. That means on the upper, we divide 3. So anyone can tell me, what can I say? What is a right lumbar regions with a plain word? I haven't put it in here, but just want to let you know that on the right lumbar region or left lumbar region, we can say the flank. Flank, that means that on the sides of the belly. Okay, so you can say to the patient, hey, you have a right flank pain or you have a left flank pain. It's easier for them to understand what you're saying. Okay, and then of course in the middle we call umbilical region. Umbilicus, that means the cái rúng của mình nó gọi là umbilicus. So umbilical regions, that means the area surround the umbilicus. Okay, and then the other one we have right iliac region, hypogastric region, and left iliac region. Okay, again, when you talk about the pain like in hypogastric region, you can say lower abdominal pain. That means that you have a pain on a lower abdomen. It's easy for the patient to understand what you say. You don't say hypogastric region because not a lot of people understand what it is. Okay, it's just a common word when you're talking to the patients. Lower abdominal pain, I have lower abdominal pain. Yes, I understand that. Okay, I have upper abdominal pain. Yes, I understand that. But not a lot of people understand when you say epigastric pain. Okay, so these words, I suggest that whenever you use it for the doctor's document. And when you talk to the patient, just use a very, very common word. Flank, that means a side. Upper belly, lower abdominal pain. It's easier for them to understand that. Okay. And I also usually use the right one, which is just 4 quadrants. Quadrants, that means là những cái phần một cái phần mà mình chia làm 4 quadrant là một trong những cái phần đó thì là right upper quadrant, left upper quadrant, left lower quadrant, and then right lower quadrant. You easier to use it rather than the left side. Okay. Anything else? Let's see what do you have. Okay. Okay, thì không biết là ở đây á mấy anh chị còn nhớ cái mà học mà lúc mà hỏi về cái đau không? Có 7 cái câu hỏi, 8 câu hỏi á.
Okay.
Yeah.
You remember?
Yes. Okay. So we're gonna apply that in here. Very common questions. Okay. Sorry, I got a hospital call. Okay. So I think we just apply one scenario in here so that you can practice with the pain. Okay. So anyone, volunteer to doing that? I need to, actually.
Can I try?
Yes. And I need another one for the patient. Okay, that's fine. So I can be a patient. So Đỗ Thị Nga, right?
Yeah.
Okay, so you're gonna be my doctors. So I'm come to you and then I say, hey, I have an abdominal pain. I got my belly hurting.
Hello, Mister. Today I will be your doctor. Now I need to ask you some questions. First one, can you use your feet? Can you use your finger and pray where exactly your pain is?
Okay. I think it's on the right side, upper quadrant.
So when did the pain start?
I started yesterday, actually.
Is there anything that is worse?
Yes, ma'am. Yes, ma'am. So whenever I eat something, I think it got worse.
Yeah. And how is the pain like?
It was sharp.
Okay. So, how long the pain take?
I think it lasts about an hour after I eating.
Is there any other symptom?
I'm sorry, say it again, ma'am.
Okay, so is there any other symptoms?
I can't.
Signs? Yeah.
Sorry?
Is there anything else besides your pain?
Oh,
like
yes.
nausea? Yeah.
Yeah, I think I got some fever too.
Yeah, you have fever?
Yes.
Yeah. Do you take any medication? Any medicine? Do you take any medicine?
Yes, I take some pain medication.
Okay, so I think that you got appendicitis, but I need to do some more tests to make a diagnosis.
Okay. All right. Thank you, ma'am. Okay. So first thing, I think I talked to you that I said right upper quadrant, right? It's right upper quadrant.
So I missed the word right lower quadrant, right upper quadrant. So
yes.
You might have I don't remember it. I did try this.
Okay. So one thing that you want to ask too is like constant or is come and goes, right? Intermittent or constant. Mm-hmm.
Yeah.
Okay. And anything that's you missing? Anyone else know?
I think she need to ask about the radiation of the pain.
Yes, yes, yes. Anything else? Okay, the next thing you can ask like new or old, right? Have you ever had that pain before? Or is this the first time you have the pain? Okay, and onset, suddenly onset or gradually onset is also important too. And then anything missing?
The rating scale from 1 to 10. Yeah.
Yes, if the patient said that I got like 10 out of 10, so you know that's emergency case. Maybe he got some inflammatory really bad of the gallbladder. Mm-hmm. Okay. So what is the inflammatory of the gallbladder? What is it called?
I think it is like cholecystitis.
Yes. And then you can put acute cholecystitis as well. Okay. Any other questions so far? Okay, so we're gonna move on to the next slide. Another medical term. Algia. I already explained it. Algia does mean pain, right? So anyone know the words about algia? Anyone remember that? Have you ever heard about the word myalgia?
Yes.
Okay, what does it mean?
A pain in a muscle.
Yes, myalgia, usually the patient complain about body ache, right? So I got the flu, so I got body ache. So how do you describe the body ache? Usually I use myalgia, emesis. Emesis, that means vomit, you're throwing up. Okay. Hematemesis, what does it mean?
Vomit blood.
Yeah, so I can break it down for you. Hemato, that means blood, and emesis, that means you vomit. So hematemesis, that means you vomit with blood, or blood, vomit like on the blood. Nausea, that means like you feel like gurgling, not vomit, but ready to vomit. All right. Intractable. People usually use a lot of the word intractable, but it means like just severe, and then it's happened like suddenly. Like you can use intractable vomiting. That means that you can stop vomit and it just happened acutely, severely, and then you can stop it. Or you can use intractable headache. That means that you can stop the headache and it's so severe that you cannot, survive, something like that. Intractable. Any questions? Anything? Anorexia. Okay. So A or N, that means that no, like don't, no. So rexia, usually you eat, and anorexia, that means that you don't feel like to eat. Does that make sense? Like dysphagia. So I can break it down for you too. You can take note that DYS, that means this, that means that something wrong. All right. So phagia, I mean you swallow it. So dysphagia, I mean that something wrong with when you swallow, right? So a difficulty of swallowing, something wrong with that. Dysphagia, I mean that difficulty of speaking, just similar word, very, very similar, but just very different meaning, okay? Adenophagia, so adeno, that means that you have pain, right? It's not this that means a difficulty or something wrong with that, but adeno, that means that you got pain on that. So painful swallowing. Okay, any other questions? Anything else? And then the word hemato, that means like your blood, right? Hematochezia. So that means that you have blood in the stool. Okay, that you actually see it. Melena, similar word, but different, a little bit different. When you see blood in the stool, you're gonna say hematochezia. But whenever you see like the coffee crowd or a very black stool, you're not gonna say hematochezia. You're gonna say melena, raising a black stool. Okay. Okay, steatorrhea. Steato, that means that you have fats, right? Rhea, that means that you just, secrete something, and in this situation is a stool. So you get fatty stool. Steatorrhea. And diarrhea, everybody know, right? Diarrhea, loose stool or watery or something like that. So bowel movement, I usually use the word when you want to ask about the patient. Do they poop or do they have a passing stool or something? And we want to use in a polite way. So we're gonna ask, do you have bowel movement today, or when did the last time you have bowel movement? Okay, that means that the patient passing stool, pooping, using number 2, if you want to say that. Constipation, right? Constipation means be bong, decreased frequency or difficulty in passing hard, dry stools. But when you talk about constipation, make sure the patient understand what is constipation mean, because not a lot of people understand constipation, right? So you can talk to the patient. Do you have a hard stool like rock, or it's really hard for you to have a bowel movement like once a week or something? But don't just say that constipation. Do you have constipation? A lot of people said, yes, I have constipation. But when you ask about more detail, they're gonna say something else. So make sure that when you say constipation, make sure that they understand and you understand that too. So again, A-N, that means no. So anuria. Urea, that means the urine. Anuria, that means you don't have urine. Okay. And dysuria, that means that difficulty or something wrong, right? This. And urea, that means the urine. So it's difficulty or dysuria. In this situation, we call that pain. When you have pain when you pee, right? When you have pain when you're urinating, that means dysuria. And then hematuria, hemato, that means that have blood, right? And urea, that means that you have urine, right? So hematuria, that means you have blood in the urine. It's just like a mixing, you know, mix and match word, and then you can create a new word, okay? Diuretic, okay. That means that the medication that make you pee more. Any questions so far in here in this slide? I think this is a lot right now.
Sorry, I had to got confused. The term is intractable.
Intractable, yes.
I don't know exactly why and how we can use the term.
So this word is usually like subjective, kind of subjective. That means that when we see the patient or when we hear the story of theirs, when we hear the story, right? We're thinking about maybe it's very severe and it just come like suddenly. Like for example, the patient said to you like, I have a lot of, you know, vomiting this morning and I cannot stop it. It just vomit and vomit and vomited, right? So we cannot put in the document said that this patient have like vomit and then he cannot stop it. And he just keep vomit. It's very long word. But if we use the word intractable vomiting, that means that when another person read your note, right? Cái bệnh án của anh á, read your note and then they can, you know, imagine that this patient really sick and the vomit is very severe. But again, you can use like severe, right? Severe vomiting, totally fine. Okay.
Okay, thank you.
Sorry, teacher. Can you explain the cause of constipation? Constipation.
Constipation, yes.
Can you explain more for me?
Okay, so this is very, very complicated when we want to talk about constipation, right? So whenever a patient come to you and say, hey, I got constipation. So you have to know, is it real constipation? You have to base on the ROM criteria, ROM, like ROME, ROM for criteria to you know, to assess the constipation. All right, it's a kind of like, you know, in depth in medication, I mean in medicine. So you have to make the diagnosis based on the criteria. And but like in here, it's just common, and then you just add, do you have constipation? Usually that what mean that, do you have frequent bowel movement like daily, right? So we just want to know that they have a bowel movement daily, like every day they poop, every day they have to go to the restroom to pass in the stool.
Yes, and I want to know more why some patient drink milk, they have constipation. Some patient drink milk.
Okay.
They have constipation.
Oh, that's I cannot answer you.
But with this milk, another patient drink is normal.
I'm not sure what that situation mean, because one patient drink milk and they didn't eat anything. It doesn't mean that they got constipation, right? Am I correct?
I want ask you. Some patient they drink a milk. They have a constipation.
Okay. So what about
but with this milk, another patient drink, they are normal. They are not have a constipation.
Okay. Right. Good. So what do you think?
I don't know. I don't know why that.
Okay. I don't know either. I don't know.
Yeah, thank you. Yes.
I'm not sure.
Yes, thank you.
Okay, but my point in here is that when you talk about constipation, make sure that you understand what it is, okay? So,
yes, thank you.
Okay, so don't just ask the patient about, do you have constipation? It's really, vague. You have to ask like how many times per week that you have bowel movement. It's easier for them. And then if you're thinking about constipation, you can ask how the stool, is that really hard like a rock, right? You know how the patient have like bệnh táo bón, and then the stool is very rock. You have to ask about those criteria, right? Characters of a stool to know more about is that constipation or not. Okay.
Yes.
Okay. Cool.
Thank you, teacher.
Any other question? Okay. So I think we can take a break now. What do you think, Anh Vân?
Hello, that's it. That's okay. We may have a break now for 5 to 10 minutes.
Yes.
Yeah?
Yes.
Okay.
And sorry, tại hồi nãy bệnh viện gọi em phải bắt máy liền đó, cho nên không có nói được.
Okay, that's it. That's fine. Yeah. Okay, then in the meantime, as usual, you can take a break with a coffee break or go doing something else.
Mấy anh chị cũng có câu hỏi gì cũng có hỏi trong cái lúc break cũng được, tại mình cũng hỏi đây.
Back to Thái Thọ's question, I really don't know about the case that somebody drink milk and have constipation, but I know a lot of Vietnamese people have the opposite.
Yeah,
when they drink milk, they have the diarrhea. Yes, yeah. So that's it. You know about that? Because I'm in my case, when I came to Canada, I have nothing wrong in Vietnam. But when I came to Canada and the first few days, I drank milk and I have diarrhea. These are lactose intolerance.
Yes, perhaps.
But about constipation, I really don't know. Because why milk create constipation? Maybe I have to go to the internet to look at it, to search on the internet to see what's the cause. I never heard about that.
Maybe because of the patient didn't eat anything and then they just drink milk. So maybe they got like, bowel movement every 3 days, every 4 days, because they didn't eat anything. They just drink milk. So maybe that's the case, but I'm not sure, like really sure why they have that, we cannot like make a judgment or assessment based on that. So I really don't know.
Okay. So in that case, maybe it's not because of milk, but because of dehydration.
Yes.
Dehydration. Yeah? It's because people don't drink enough, don't drink water enough. So they have dehydration. And when they have dehydration, they have constipation. So that's my guess.
Yes, thank you, teacher.
Yeah, I think the milk Thái Thọ mentioned is formula milk for kids, not fresh milk. Is that right?
For others, just milk I talk is for others. But some patient drink is normal, but some patient drink it, they tell me it's constipation. It's actually just milk.
Yeah, but in Vietnam we have two kinds of milk. When I was in Vietnam, we didn't have fresh milk. We just have condensed milk. Sữa đặc đó em. Sweet condensed milk. Ngày xưa đó không có cái milk bây giờ. Yeah. Thái Thọ, so you say that about the fresh milk or the condensed milk, the sweet condensed milk from the can?
I think it's not fresh milk because fresh milk is
so condensed milk is quite different stories.
Yes, perhaps.
Yeah. Here in North America, people rarely use the condensed milk like in Vietnam. Usually they buy the condensed milk for baking, cooking or something. They don't drink it. Yeah, but because Vietnamese, we have very famous Vietnamese coffee. They use condensed milk, and we never use it here in North America.
Hello, teacher. I want to ask about some symptom of infection of urinary tract infection. I see urethral ulcer. I want to ask about polyuria. In a previous text,
yes, I understand what you say.
Tiểu giác bởi vì
yeah. So
I couldn't hear that. I'm sorry.
Yeah, that's
nhiều nhà dùng ít nó có thể mình có thể tiểu nhiều lần nhưng mà có thể tổng số lượng nước tiểu không nhiều. Là bệnh nhân chỉ tiểu giác thôi nhưng mà không phải là đa niệu.
Yes. So we have polyuria and urinary frequent. So it's kind of different. So polyuria, that means you pee a lot. You pee a lot with a lot of volume, like big volume. But like we have another word for đi tiểu lắc nhắc này nọ, like urinary frequency. That means that you go frequency, but it's not a lot of urine in that. So kind of different, a little bit different, but from that.
Em cảm ơn ạ.
Okay. Is that the answer, or anh Vân want to say something else?
That's a good Pham. Okay, you have the polyuria, you have increased urinary frequency, and you have incontinence. That maybe we will have in the next slide. Yeah? So you know incontinence and that is 3 terms that you have to make clear definition about that. Yeah? Okay. Mấy em biết cái chữ incontinence không? Mình sẽ học tới. Okay.
Không liên tục.
Incontinence. If you translate directly from Google, it's không liên tục. But in medical terms, it's quite different. Yeah.
So we also have the word like urgency. That means that you want to go that like urgency, but actually you don't have urine, or you have to go like more frequently with urgency.
You know, this is a funny story here in Canada. They have the movement from the female people. It's a slogan. When you have to go, you have to go. You know, there's a meaning. When you have to go, you have to go. There's see the same phrase but a different meaning. Khi mà mắc tiểu là phải đi liền. When you have to go, you have to go. Okay, so that's a slogan.
Yeah, ở đây không vậy. You gotta do what you gotta do.
Yes.
So you have
the
to
same. Yeah, you repeat the sentence, but they have 2 meanings there. That's it.
Thì mấy cái medical term này á, thực ra là nó hơi bị khô khan, cho nên mấy anh chị á, là cố gắng làm lúc mà mình ngồi nghe mình viết lại á, thì nó sẽ dễ hơn, nếu không là dễ buồn ngủ lắm. Tại mấy cái này nó cứ bỏ chữ, nó cứ nhảy ra vậy thôi à. Mà thật ra là mình có thể lên mạng đọc hay là gì cũng được hết. Nhưng mà ở đây á, là mình muốn nói cho mấy anh chị biết á, là mình có thể dùng những cái medical term, những gọi là big words, để mà mình nói chuyện với bác sĩ với nhau. Nhưng mà một khi mà mình nói chuyện với bệnh nhân á, thì nhiều lúc bệnh nhân người ta không có hiểu, thì mình cố gắng á, là mình hiểu được cái từ ở trên cái slide là cái gì, mình ghi ra theo ý của mình hiểu. Tại vì cái ý của mình hiểu đó nó rất là đơn giản, rồi mình xài cái ý của mình hiểu á, mình nói chuyện với bệnh nhân vẫn được như thường, chứ không có bệnh nhân nào mà đòi hỏi là mình phải xài medical term. Cố gắng là ghi theo ý của mình hiểu. Giống như hồi nãy mình có nói là gì, cái esophagus này là cái ống thực quản á, thì nhiều bệnh nhân ta không hiểu thì mình có xài là food tube, cứ xài vậy thôi. Rồi thí dụ như những cái mà những cái từ như gallbladder này nọ, mình nên xài những cái từ đó để mình nói chuyện với bệnh nhân dễ hơn là mình xài những cái từ mà medical term. Medical term là để mình nói chuyện với bác sĩ với nhau dễ hơn, thì là mình doc của mình nó chính xác hơn. Còn để mà mình giao tiếp thì nên xài những cái từ dễ hiểu hơn cho bệnh nhân, mà cách thì dễ hiểu nhất là mình hiểu cái gì mình ghi ra, xong mình xài những cái từ đó mình nói cho bệnh nhân. Thì nếu mà mấy anh chị ghi ra xong rồi có thể hỏi ngược lại bên mình để mình coi coi lúc mà mấy anh chị ghi cái definition có chính xác hay không, thì mình có thể sửa được. Cái thứ hai là những cái medical term này nó gần như nó lặp lại đi lặp lại rất là nhiều. Cái là prefix với lại suffix á, nó lặp lại. Nếu mà mình đọc quen hoặc là mình học quen á, thì nó rất là dễ để mình ghép từ với nhau. Tại vì thật ra có nhiều chữ á, mình bên đây mình xài đi khám bệnh mỗi ngày mà chưa chắc mình xài được nhiều nữa. Thì nhưng mà mình có thể nhìn mình đoán ra được chữ đó, chứ không nhất thiết là mình phải học thuộc. Mình có thể đoán được cái chữ đó để tại vì có những cái suffix với lại những cái prefix đó, nó rất là thông dụng, nó ghép được với nhau thì mình là hiểu được cái nghĩa của nó.
Cũng nhắc thêm mấy em đó là cái mục đích của cái khóa học này là như là anh Phạm Nguyễn nói đó, tức là nó rất là đơn điệu nhưng mà nó lặp đi lặp lại, mấy em sẽ đoán ra đó là một chuyện. Chuyện thứ hai nữa là không dùng cái thuật ngữ đó để mà nói chuyện với bệnh nhân, mà phải dịch ra bằng cái lay terms đó, để nói chuyện bệnh nhân. Mục đích của cái lớp học này chỉ có hai chuyện đó thôi.
Ok, thì mình bắt đầu được chưa ta? 10 phút rồi. Ok, mọi người tới đủ chưa?
Rồi cứ tiến hành đi.
Ok, let's try this. Ok, thì tới cái phần này là phần mình thực tập. Ok, thì nó sẽ lặp đi lặp lại á. Thì anyone knows what does it mean so that you can speak and I can fix it if you're wrong. No worry about that.
So gastritis is inflammation in the stomach.
Yes, inflammation of the stomach or inflammation in the stomach is okay. That's fine, perfect. Okay, and GERD, we usually say GERD, gastroesophageal reflux disease. Okay, so let's say about the word gastroesophageal. So what does it mean?
Yes, I think gastroesophageal reflux disease means the stomach, it cannot contain something cannot contain food, so food can go out stomach to the esophagus, like
yes. Yes. So gastro means stomach, right? Gastro. Esophagus or esophageal, that means the food tube, right? And reflux, that means go backward. Reflux, it's not go down, it's go backward. So that would mean that something inside the stomach go backward to the food tube. Okay, and this one usually we call it GERD. Everybody knows that GERD. Okay.
Yeah.
Okay, duodenal ulcer. Okay, so duodenal, that means some part of the intestine, right? So after the stomach, you have a tube go to the intestine, and duodenal, that means that tube. It's very specific. We have like duodenal, we have like jejunal or something like that. Very specific on that. Okay, and ulcer, that means I got lesion. Giống như là ulcer là gọi là mình không biết tiếng Việt là gì, nó là một cái vết thương á. Loét, là một cái vết thương, mà cái duodenal là cái phần mà nằm sau cái dạ dày của mình á.
Loét tá tràng.
Yeah, tá tràng. Yes. Hepatitis. So anyone?
Hepa mean liver. Itis is mean inflammation. So hepatitis is meaning inflammation of liver.
Yes, perfect. So inflammatories of the liver. Okay, it could be everything, right? Hepatitis B. Have you ever heard about that? hepatitis A, hepatitis B, hepatitis C. That's just the short word. Actually, we have to use like viral, viral hepatitis B, viral hepatitis C, something like that. But hepatitis, that means inflammatory. Okay. Cirrhosis, very, very common word. Cirrhosis.
Cirrhosis, I think is quite difficult because cirrhosis, I think it's a common disease in my country, but it's so difficult when explaining to the patient.
Yes, yes. It's very difficult to explain to the patient what is cirrhosis. Even though in Vietnam, right? In Vietnam, we cannot say like xơ gan nghĩa là gì, right?
We have some about blood exam and ultrasound of the liver and abdomen to count the score of typhus for cirrhosis. I think that's
okay. So there's an easy way, I'm not sure about your situation, but easy way to explain for the patient what is cirrhosis mean. That means the dysfunction of the liver. So dysfunction, that means cái gan á, dysfunction, that means là nó không hoạt động đúng nữa, dysfunction. So I usually talk to the patient, is a dysfunction, liver dysfunction or dysfunction of the liver, so that they understand, okay, the liver not working well, okay, it's not working properly right now. But we have to, if you want to say like definition, it's really, really difficult for them to understand what is, fiber and everything, something like that for a liver. So just make a simple dysfunction of the liver, okay?
But in Vietnam, we frequent ask patient, have you ever cirrhosis? And the patient know, because if they had before, the doctor talk this to the patient. So we ask, have you had cirrhosis?
Yes. So me too. So whenever I talk to the patient, I also said, do you have cirrhosis? Have you ever heard about cirrhosis? So that if they know they have that, they're going to say, yes, I have cirrhosis for a long time, for years. But if some people said, I never heard about cirrhosis. So what do you mean by saying cirrhosis? So we have to have ability to explain what we ask, right? So if the patient didn't know about cirrhosis, you just say simple thing like your liver got, dysfunctional. Okay.
Yes, thank you.
All right. So you can guess a little bit. Okay. What is that? What does that mean? Cholecystitis.
Cholecystitis means gallbladder. Itis means inflammation.
Okay.
So cholecystitis means inflammation of the gallbladder.
Yes. So you can say cholecystitis. Cholecystitis.
Cholecystitis.
Yes. Just go slower as you can. You don't have to say like so fast, cholecystitis. That's fine.
Cholecystitis.
Yes. Okay, cholelithiasis. What does it mean? Cholelithiasis. Yes, yes. Cholelithiasis. Yes. Yeah, so there's some stone in the gallbladder. Yes. So it's kind of different, right, between cholecystitis and then cholelithiasis, right? So a little bit different. Yes. Một cái nó là nó bị gọi là gì ta, inflammatory là bị nó bị không phải nó bị sưng lên, nó gọi là gì ta,
bị viêm
bị viêm. Yes, một cái là một cái nó bị viêm, với một cái là nó sỏi túi mật, hai cái nó khác nhau. Ok, pancreatitis, what is that?
Pancreas, that means inflammation of pancreas.
Yes, pancreas. Yes, pancreas.
Yeah.
Pancreatitis. Yes, inflammatory of the pancreas. So we have intestinal obstruction. So anyone can guess?
Obstruction, I think it means the tắc nghẽn. It can flow in normal. So
yes, word block. It's word block.
Yes.
Obstruction, I mean blocks.
Block.
Okay.
Yes, block. Yeah. It had the block in the intestine.
Yes. Or I usually use a bowel obstruction. Bowel, that's mean intestine too. Okay, bowel. B-O-W-E-L. Bowel obstruction. Ascites. Okay. So anyone knows about that? Ascites.
I think ascites is the excessive amount of fluid in your abdominal space.
Yes. Peritoneal and abdominal is a little bit different, right? So you know that khoang bụng với lại cái peritoneal, hai cái nó khác nhau. Sorry. So also the patient understand that too. So a lot of patients that I'm asking, they know that they have ascites. But if the patient don't understand that, you can say that too. Is there any fluid? There's some fluid inside your belly. That's it. So we don't have to, say to them that is a peritoneal space, like the cavity, or is abdominal cavity is different, a little bit different, but you can say to the patient that there's some fluid, extra fluid inside your belly. Okay.
No, teacher, you write that a large amount of so if a little of blood, we can say ascites.
No, I mean that you can say that too. It's not a large amount of fluid. I think it's wrong. It's just a fluid, like extra fluid, like some extra fluid inside the cavity is also called ascites. Okay.
So if it's only a little, and we only said that there be a little of blood in the
peritoneal
space. Oh, thank you.
It's also correct. And the next one is colitis. What does it mean?
It's the inflammation of colon.
Yes. Well, that's why it's really difficult. Glomerulonephritis. Glomerulo. That means that trong cái thận của mình nó có những cái cầu thận nhé. Những cái cầu thận nhỏ nhỏ thì nó gọi là glomerulonephritis. That means that you got some inflammatory of the glomerulo. Okay. I don't have any pictures in here, but you can go for that. That's why I talked to you that, right? So barely use the nephritis. Nephritis, that means is something happening in the kidney, but we don't know why. If we're thinking about the patient have like bacteria infection, we're gonna go pyelonephritis. Okay, never use nephritis alone. Okay. Any questions about that? I think it's a little bit confusing here, but just make sure that you understand when you when you use the word. Okay, incontinence. Incontinence. Anyone know?
I think continence is the can mean it can control. So in that it means it can control urinary. I think so.
Urinary.
Urinary. Yes. You can control urinary. Yes.
Yes. So you can use urinary incontinence, or I usually use fecal incontinence as well. That means that you can control your bowel movement too. Okay.
Bowel. Oh. Is
okay.
the bowel? You can use this term for the bowel movement.
Yes. Yes, you can. But you have to make sure that you put the word right. Urinary incontinence. That means you can control the urination. And fecal, F-E-C-A-L. Fecal incontinence. That means you cannot control your bowel movement. And you usually see those things when you read a note like urinary incontinence and fecal incontinence, usually to talk about a seizure.
Seizures.
Yes. Động kinh á, thì một số người động kinh á, người ta sẽ không có control được cái nước tiểu với lại cái thải phân, thì người ta sẽ xài là urinary incontinence and fecal incontinence. Any questions about that?
So can you explain again? Is when you seizure, so patient can uncontrolled urinary. So we can use the term. What term? I cannot really clearly.
Urinary incontinence. So this one incontinence, right? But you have to put before that urinary.
Urinary. Okay. Thank you.
Incontinence. Yeah. And also somebody asked me about the incontinence. So we can have like urinary incontinence, and we also have urinary urgency, something like that. Is a little bit different between those words. Okay.
Thank you.
Cái incontinence này á là giống như là nó bị leak cái nước tiểu mình ra, cũng gọi là urine incontinence, urinary incontinence, nó leak ra, nó bị chảy ra mà mình không có control lại được. Ok, có một cái nữa là urinary urgency, đó có nghĩa là mình mắc tiểu mình phải chạy đi tiểu. Hai cái khác nhau, thì có hai cái có thể xảy ra cùng một lúc nữa, mình chạy đi không kịp thì nó incontinence cũng được luôn. Ok. And nocturia mean that nocturnal có nghĩa là buổi tối á. Nocturnal. Urea, that means urine. So nocturia, that means that you have to go to the bathroom at night more frequency. Uremia. What does it mean, uremia?
I think it means the high level of urea in the blood.
Yes. So so emia that means blood, in like related to blood, right? Emia. Have you ever heard about hyperlipidemia? Like emia, hyperlipidemia. Yeah, something like that. Any other questions so far? I know that it's a lot of terminologies that you have to learn, but again, you can see that it's a repetition, right? The repetition between those words, and if you read it more, you can get familiar with that too. Okay, so don't be scared to see the new word, but actually you already understand half of them, like emia, that you mean that, you know, and blood and uremia. Maybe you don't understand the uremia, like urine, but you understand something related to blood, something like that. Is that easy to understand, or it's confused or something? Okay, so right now I just move on to the next about some labs, and then, you know, radiology, and then some other diagnostic, you know, tests for you. Abdomen ultrasound. Anyone familiar with this thing?
So abdomen ultrasound, it means you use some a medical instrument that to see inside their belly.
Yes. So you can say to the patient that you use a prawn, right? A prawn like là những cái đầu giò, prawn. So you can explain to the patient that I use a prawn to check your belly, all right? And just make sure to them that I'm not going to do any invasive or something like that. You can add something else, but you can say it's a prawn, right? A prawn to check your belly, to see what happened inside your belly. It's easier for them to understand, okay? But that definition is very good. CT scan abdomen, okay? Or some people said to me that a CAT scan is okay. CT scan or CAT scan is the same, okay? So how do you explain to the patient about CT scan?
It means you use the x-rays to check their abdomen.
Yes. So I usually explain to them that, okay, I'm going to take a picture of your belly. But this machine, it takes a lot of pictures, to see what's really going on inside your belly. But we don't go too beyond that because we have to explain what is this, the CAT scan is, what is MRI, what is X-ray. Patient didn't need to know all of them. All right, don't make them confused too. So this one, I never say that word. Never ever say that word. I just use EGD and that's it. So whenever I say to patient or doctors, I just say EGD and that's it. Okay, but you can break it down. Okay, so it's esophagogastroduodenoscopy. It's very long word. I never use it. Just use EGD. Okay, but you can break it down and anyone can explain it to me.
This procedure uses a special tube like a camera to see the structure inside the esophagus, stomach, and duodenum.
Yes, so stomach. So make sure that you get stomach. And then the food tube, esophagus, yes. And intestine, okay, duodenum, okay. So usually we go EGD, easier. Okay, colonoscopy. Anyone to explain that word?
Endoscopy. No, that means endoscopy of colon.
Okay, so what does it mean? So I'm a patient. I don't understand that.
I have a camera in post a column and can see
Yeah. Yes. So I usually talk to the patient, said that colonoscopy, that means I'm gonna use a small camera with a tube and go from the bottom inside your intestine or your colon to see what's going on in there. Okay, so they can understand that. And then, because this is a patient choice, right? They don't want it. You have to explain that to them. Like it's like colonoscopy, I didn't familiar with that, so I don't want it. So you have to explain that to them in a plain word so that they can understand what it is and what is the procedure mean to them, okay? So abdominal synthesis, okay? So synthesis, that means that you want to take something out, like you use the needle to take it out. I usually use paracentesis. That means it's similar to abdominal synthesis, but it's a stronger word. So synthesis, that means that you take some fluid out by the needle. Abdominal synthesis. Enema. Okay. Anyone familiar with that one?
I think animal it have two meaning. The first one should be like a procedure that you inject a liquid into a rectum. The other meaning is like the medication that you give to the patient to do that.
Yes, correct. So basically, I just talked to the patient, said that okay, enema does mean that I'm going to use some medication to softening your stool to make you have, bowel movement because you got constipation, something like that. You can explain very, very simple to the patient. Faults, fecal occult blood test. So fecal, the word that means stool, right? So as I said it before, fecal incontinence, that means that you cannot control the stool. So fecal, that means stool. Occult, that means hidden. Like something hidden is something covered, right? Occult blood, that means that you cannot see the blood in the stool. Fecal occult blood, that means the blood inside the stool and you cannot detect by your eyes. All right, you have to do the test to make sure that the patient have, blood in the stool or not. And we usually use the word for FOBT. Whenever I say FOBT, everybody understand that. So make sure that you're familiar with that too. Catheterization. So what does it mean? Catheterization. I'm not sure is that familiar with the Foley catheter. The word Foley. I usually use Foley, like it's a tube, right? Foley catheter does mean that you put the tube inside the catheter.
Cái này là đặt tông tiểu đúng không thầy?
Yes.
Đặt tông tiểu.
Yes. Nhưng mà mình có thể xài cái từ là Foley, put the Foley in. That means that you use a catheterization, right? But we usually use, when we talk to the nurse, said that, hey, I want a Foley in. That means that they're going to put a Foley, the tube in, or I want a Foley out, or you want to clamp the Foley. So the Foley is just a specific name for the catheter, for the urinary system. Okay, you can use catheters for the vein, for the central line as well. But when we say about a Foley, that means just the urinary catheter. Okay, am I clear for that? And then here okay, go ahead.
Yeah, can I ask, like, because I look at the pronunciation like catheterization, so I assume that is there any missing spelling the T-E-R in the word catheterization, or we just write like short like catheterization like that?
Catheterization. I think this word is correct, but I'm not sure because I never use the cái spell cái pronunciation này nên mình không biết.
Okay, can I use like catheterization? Is it also correct?
Catheterization? No, I don't think so.
Okay.
Excuse me, I think it's just the wrong spelling there. We pronounce catheterization. It's not catheterization. Sorry, that's a wrong word. Yeah, I think so.
Catheterization.
Catheterization. Yeah.
Catheterization. Sorry, I have a question.
Sorry, I checked in Merriam-Webster dictionary. I see the words are the words, the meaning, the same meaning. Okay. Mr. Mindo, write in the table. Catheterization. T between terize.
Okay. Catheterization. Usually we call it catheterization. But yeah, Dr. Minh Nguyen is correct rather than me, because usually we use it.
Me too. I never use it. I just say calf.
Yeah. Yeah.
So,
me too.
Sure.
We call calf. But yeah, so.
Sorry, I have a question.
Yes.
If we use put the folate in, so when we remove, so we can use the term now. If we want to know.
I'm sorry.
So if you can say put the folate in, it means the catalyzation. However, after that, when you finish, we want to remove. So we can use the term now.
Which term is that?
Yeah, khi nào kiểu mình gọi là rút thông tiểu thầy, thì mình sẽ nói là sao?
I never heard. I never thought about it. I usually do like remove the Foley or remove, the catheter.
Okay.
Just say take it down, right? So because catheterization just only insertion, but not removing.
Yeah, I'm not sure. Do we have the medical term for that, like in cath or something? Uncath or in cath or decath or something?
I don't say decath.
No, right?
In cath is okay. Say that the in cath, that is the needle or something still in the vein. So we call in cath. But decath, I never heard about that.
I never use that word. It just say remove. Yeah, usually you remove the catheter or remove the Foley.
But this here is two different terms. One you call the tube. It's a very common name. Huh? And when we say catheter, so you just define either urinary system or vein system or artery. So something like that. I don't know why, but you have the tube like nasogastric tube. You have something like that. So tube and catheter is quite different.
Wow. Okay, thank you for your information. Anything else? Or I'm going to move on. Urinalysis. Okay. Anyone want to explain that?
Urinalysis means you can analyze the urine of patient.
Yes.
And see any protein, any blood in the urinary in patient.
Yes. So I usually use the word UA. So it's easier.
UA?
Yes,
UA.
U and A. Yes.
Thank you.
Cystostomy. Anyone can guess that? Difference between them? Cytostomy and cystoscopy. Right, stomy and a scopy.
Okay, cystostomy. I guess it means surgical to opening into the bladder. I'm not sure about that, but I guess the meaning cystostomy is surgical to open into the bladder.
Yes. Yes.
And see something. Okay, sorry. Okay, just I would like you to be careful about that term, cystostomy. Cystostomy, because ostomy different from otomy. Say. Yeah. So ostomy, that is you opening the bladder to the skin. Mở bàng quang đó em, mở bàng quang mà ra da đó là ostomy. Otomy, you just make incision in the bladder. So one is a cystostomy and one is cystostomy. Okay, yeah.
Correct.
Okay, go ahead. Yeah.
Thank you.
Từ này có nghĩa là mở thông bàng quang không thầy?
Đúng rồi.
Yes.
Mở mà để cho cái bàng quang dẫn nước tiểu ra ngoài đó là ostomy.
Nước tiểu ra bên da.
Cystostomy is opening into bladder and create a hole.
Yes. And drain the urine out.
Yes.
Now, cystoscopy. Yeah, go ahead. Yeah.
Cystoscopy nghĩa là soi bàng quang, nghĩa là mình đưa một cái thiết bị mà từ dưới chỗ.
Okay. Say in English, yeah. Try to say in English. Okay.
Is procedure visual examination with endoscope to see the bladder.
Okay.
Good. Hemodialysis. Wow. What does it mean?
It means using a device to filter the blood to remove the waste from the blood.
Yes, yes. Hemodialysis, that means that you dialyze a patient with something, right? Usually with a CKD patient, right?
Lọc máu à?
Yes, yes. Lọc máu. Okay.
Thầy cho em cái này nó sẽ tiếng Anh nên là chắc em hỏi tiếng Việt. Ví dụ mà cái lọc máu ấy thầy, với cả cái mà chạy thận á, nó khác với nhau hay là mình đều xài bằng cái từ này hết?
Nó có một cái là cái này là lọc máu, còn một cái nữa nó lọc qua cái bụng á.
Dạ.
Yeah, là hai cái nó khác nhau.
Không, ý cái lọc máu vụ mà trong ICU á, vụ mà khi mà mình như kiểu là mấy cái bệnh nhân bệnh nặng kiểu nhiễm trùng huyết hay cái gì mình sẽ có lọc máu này, với cả cái lọc máu mà kiểu chạy thận thường xuyên mà một tuần mấy lần á là vẫn giống nhau mà đúng không thầy? Ý là mình vẫn xài cái từ này đúng không?
Hai cái đấy là khác nhau mày. Cái lọc máu này là cái lọc máu mà trong những bệnh nhân nặng ấy, còn đâu cái kia là người ta gọi là lọc màng bụng ấy. Chạy thận nhân tạo nó là lọc màng bụng, nó chỉ làm cái cầu tay các thứ.
Không.
No, cái hemodialysis này cũng là chạy cho người bị bệnh thận luôn.
Dạ.
Dạ.
Ý anh ấy hỏi là cũng là chạy cho người bị bệnh thận, nhưng mà ý của theo em hỏi ý của anh Tùng là cái chạy cho người bị bệnh thận nó cũng có mấy mức độ ấy. Bởi vì là có những cái mà bệnh nhân mà phải lọc màng bụng thì sẽ đặt một cái thiết bị và nó không chạy bằng lọc máu mà nó chạy bằng cái dịch trắng, em quên mất tên rồi. Em hiểu ý của...
Ok. Cái này là đúng ra thì nguyên tắc là nó giống nhau nhưng mà chỉ cái dụng cụ nó khác nhau. Ví dụ chạy thận nhân tạo thường đó là cái hemodialysis, còn kia peritoneal dialysis nó cũng dialysis nhưng một cái nó để chỉ tên khác nhau. Một cái là cái máy thật sự, còn cái kia là cho dịch vào rồi cho vào rồi cho ra, thì cái đó là hay. Yeah.
Dạ, cảm ơn ạ.
Thưa thầy, lúc nãy có cái xét nghiệm nước tiểu ấy ạ, thì ở Việt Nam có một cái xét nghiệm hay làm là soi phân, thì ở đây chỉ có mỗi cái tìm máu ẩn trong phân thôi. Thì cái soi phân để tìm hồng cầu, bạch cầu trong chẩn đoán nhiễm khuẩn tiêu hóa hay là viêm ruột ấy ạ, thì ở bên Mỹ có dùng không ạ?
Thường bên đây nó gọi là stool study á. Yeah, có stool study thì mình mà nó có cái gọi là chung thôi, mình làm stool study có nghĩa là y tá sẽ lấy xong rồi gửi đi, thì lúc đó nó sẽ làm rất là nhiều, nó làm hồng cầu, bạch cầu, parasite, over, trứng rồi tùm lum tà la trong đó, gọi là stool study. Yes.
Tôi thấy cái app OBT thì làm thế nào không? Cũng thể luôn là vậy đây. Focus blood test.
Yes. Thì sao?
Tìm máu ẩn phân. Cái này là tìm máu ẩn phân anh Thọ. Tìm máu ẩn trong phân. Thế còn
cái từ hidden thì có nghĩa là chắc là nó nghĩa là cái máu rất là ít đấy, thành ra dùng cái từ hidden là như thế. Hidden là ẩn, nhưng mà ẩn đấy có nghĩa là vì cái số lượng máu trong phân rất là ít thì phải có soi thế nào mới thấy được, anh đoán.
Nó có một cái test thì có thể là ẩn, có nghĩa là mình không thấy vậy thôi, còn nhiều hay ít mình không biết. Mình không có thấy, mình không có thấy nhiều hay ít mình không biết.
Cái này là để chẩn đoán xuất huyết tiêu hóa dưới ạ. Mình phân biệt với cả những trường hợp mà nhìn phân nó có màu nâu nhưng mà lại không phải có xuất huyết tiêu hóa, mình sẽ làm cái test tìm máu ẩn phân.
Yes.
Cái tìm máu ẩn là dùng cái chemical, dùng cái phản ứng về hóa học, chứ không phải dùng cái kính hiển vi mà xem. Đó là gì?
Ok, còn câu hỏi nào nữa không ạ? Ok, thì là so this part we're gonna just practice, right? And then we already practiced about abdominal pain before. So next, I'm just want to ask about you guys want to ask some questions about when the patient said that I have diarrhea. So make sure that those things that you can, some questions that you can ask for the patient to clarify what is a diarrhea, okay? Or vomits, like amount, blood, color, and duration is ABCD, easy to remember, right? So the pain, gonna ask like LMNOPQRST, right? And then when you got like vomiting or diarrhea or something, you're gonna do ABCD. Okay, amount, how much did you vomit? Like a bowel or a bottle of 500 ml? And how often is that? Okay, so those questions that you have to ask the patient if they said that they have vomit, right? And then blood, you see blood or how much blood that you see. Okay, so some people just said just small amount of blood, or one of them said it's a bowel, like a 500 ml blood. So you know what is different, and the color too. So usually the patient gonna say a clear liquid or greenish is just like green, but like it's a different level of green, like so usually they say greenish or yellowish. They're not sure. Chữ ish có nghĩa là không biết là phải màu xanh lá cây không hay là vàng hay không, thì người ta sẽ nói là greenish hay là yellowish, giống như là vàng á, kiểu giống mình nói này, hơi vàng hơi xanh thì mình sẽ nói sao, thì thường là tụi bên đây tụi nó sẽ nói là greenish or yellowish. Ok, thì nó không phải thiệt sự là màu vàng khè, nhưng mà nó là hơi vàng hoặc là vàng xanh kiểu vậy, tụi nó sẽ nói là greenish hay là yellowish. Rồi coffee ground là màu đen như là mùi bã cà phê á. Right? Coffee ground or digested food, that means that when you throw it up, right, you see some food but it's just digested or indigested food, that means that you haven't digested and then you just throw it up. Okay, is that easy? Clear? Okay. And then how long do you have this symptom? All right, very important. I just had yesterday, I have like 1 month before or something like that. You have to asking for that. So those questions is very important for you, and it's just study by her. Just remember the question, and then after that you can adjust your question, your style or something. But this question is very common, and then you ask the patient, they're gonna understand what you say. Okay. Any question about this?
Teacher, today we have many medical terms.
Yeah, I know.
We have to learn many times, can remember this or this medical term.
But this is the first time that we finish on time. So that's the reason why Dr. Nguyen gave you the handout, because you have to look at handout first, and then you go to the class and you read it and you review it. Just repeat so many times so you can remember it. Otherwise, no way, because like a new words, totally. Even the American or Canadian, they still have to remember like you. Okay. No way.
Mình cũng vậy, mình mà không xài là quên liền, không có nhớ được mấy cái từ, giống như là mấy cái từ hồi nãy anh Vân mà không nói em cũng không có để ý nhiều luôn. Tube, catheter, khác sao, hay là ostomy, tomy, otomy, something little thing that if we don't use, I didn't use much, so that's why I don't remember much about that. Okay, that's why you have to practice. That's the only way, I think that's the only way that we can remember all the words.
And you have to remember that all the stuff will be in your examination.
Yes.
So try to remember. Maybe after that, after the course, maybe you forget everything, but at least you still know how to guess the terms, the medical terms. Yeah. Nhiều khi mấy em sau khóa học này mấy em thi hết đậu rồi ha, mà em quên tút lút, tôi cũng vậy luôn ha. Nhưng mà mấy em còn nhớ được cái nguyên lý đó, mấy em còn biết cái chỗ nào mà mấy em lật ra để mấy em tìm cái chữ đó, phải không? Đó là quan trọng.
Và một cái nữa là mấy anh chị cố gắng là xài, ví dụ như mỗi ngày mình mà áp dụng được cái gì mình áp dụng cái đó, tại nếu mà không áp dụng thì nó sẽ quên liền, nó không có giữ lại được lâu đâu. Mình ở đây mình xài rất là nhiều từ thì gần như là mỗi ngày luôn, nhưng mà nhiều từ mình không có xài tới á, là tự nhiên nó quên, rồi mình đọc lại mình phải make sure là mình hiểu chính xác nó là cái gì nữa, cho nên không phải tự nhiên mà nó nhảy vô được đầu đâu, phải practice mỗi ngày, gần như là mỗi ngày luôn.
Mà mấy em cũng nhớ ở đây đó, tất cả những cái thuật ngữ mà listed trong cái handout của mấy em á, là các bác sĩ đã tìm những cái từ thông thường nhất, sử dụng thông thường nhất trong lâm sàng cho mấy em. Chứ mà nếu mà để cho giống như một cái cuốn sách, giống như mấy cái cuốn về terminology đó là mấy em chết liền. Tại vì nó phận sự của nó là nó phải liệt kê ra hết. Còn ở đây cái cua của mình đó là mình chỉ sử dụng những cái từ nào thông thường nhất, sử dụng nhiều nhất trong bệnh viện. Đó là hai cái khác nhau. Do đó những cái chữ này là những cái chữ là mấy em cần phải nhớ. Okay.
Mấy anh chị có câu hỏi nào nữa không?
I want to ask to use the lay term using number 2 for bowel movement. I don't know how to ask the patient.
So I usually ask them like, how about your bowel movement? How often do you have bowel movement? Or do you have bowel movement today? Or do you have bowel movement yesterday? Or you can say straight, you have a number 2 today, you have number 2 yesterday, something like that. They will understand that.
Chị ơi, chị cho em hỏi luôn là cái từ đấy thì chị dịch ra tiếng Việt là gì ạ? Chỉ là đi đại tiện rồi.
Đúng rồi.
Đại tiện.
Yes.
Pooping. Vâng, pooping, nhưng mà number 2, why we need to add number 2 in the explanation?
Oh, because some patient they're not gonna say, they're not gonna say to you that I have bowel movement or I have a poop or something. They're gonna say, hey, I have number 2 yesterday. If you don't understand number 2, they don't. How can you asking more, right? So I just want to list it for you.
Okay, thank you.
I'm hearing you say about 500 ME, not milliliters. We often say milliliters, but I'm hear you say 500 ME. Exactly that.
ml.
ml, not milliliters.
I barely use it. Milliliter or centimeter or liters or something. Yeah.
It just cái milliliter nó nhiều thứ lắm mấy em. Ở đây ha, thường là nó là ml là. Còn ML. Không đó còn nói là mil. Mới đầu tôi nghe không nổi nữa. Mil. Đó là mil là ha. You have 50 mils là ml đó, milliliter luôn.
Yes.
Hoặc là gọi là milliliter, đúng ra là milliliter chứ không phải milliliter. Trong cái bệnh viện á, nó xài nhiều tiếng lóng và nhiều tiếng tắt. Mấy em không thể nào mấy em hiểu hết được, nhưng mà có những cái thứ tiếng á là thông dụng, bệnh viện nào cũng xài hết thì chúng tôi đưa vào đây. Còn có những cái thứ á là mỗi bệnh viện nó có cái đặc điểm của nó thì không cần biết ha. Tại vì mình đến thực tập chỗ đó thì mình mới học cái đó, chứ mình không có tài nào mình nhớ hết, mình không tài nào mình biết hết.
Nhưng mà cái là mấy lần mà em mới qua đây mình cũng không có hiểu hết đâu, bắt buộc mình phải hỏi chứ không thể nào mà mình vô là mình hiểu hết được. Giống như có lần nó hỏi em là I know, em không có hiểu I know, xong mà sau này mới biết là nó là intake output, and it says I know, what is your I know, mình không hiểu thì mình phải hỏi. Có những cái từ nhỏ vậy thì mình phải có kinh nghiệm chút. Thì mình ở đây mình muốn truyền tải hết mấy cái common thôi, chứ thật ra nếu mà nói hết thì chắc không có thời gian, với lại cũng không biết nói cái gì luôn.
Dr. Pham told you a very important thing. Khi nào mà em không biết á, thì em hỏi. Chứ đừng có nói yes. Ha. Mình không biết mà mình cứ giả bộ là biết á, là cái đó là đại kỵ ha, đại kỵ trong healthcare. Có nhiều người á, tại vì sao mình không phải nói thật, tại mình làm việc nhiều mình biết là hầu hết là immigrants, tiếng Anh đâu có rành, nhưng mà có cái khuynh hướng á, cứ yes, I know, mà hỏi ra không biết gì hết. Mình chớ bao giờ mình làm vậy ha, mình không biết thì mình hỏi ha. You have to confirm, confirmation and verification, cái đó là quan trọng lắm. Okay, anything else? Hôm nay là làm tốt lắm Nguyên, làm tốt lắm Phạm Nguyên, tại vì vừa đúng giờ mà vừa gọn vừa trúng, chứ nhiều khi kéo dài quá cũng không nổi.
Okay,
that's it. So next week you have Tết holiday, so we off. Tuần sau là Tết rồi mấy em off ha. After Tết holiday, you have 2 weeks more before you have the midterm 2 examination. Okay, so try to trong khi Tết mấy em thì vui Tết rồi phải không? Nhưng mà nếu được thì mấy em cứ lật mấy cái handout ra ha, cái handout ra để mà lật ra coi cho nó quen, cho nó nhớ rồi. Okay.
Thank you, teacher.
That's it. So thank you very much, Dr. Pham Nguyen. We appreciate that you help us today because it's halfway already, and I hope that everybody will go to at the end of the course.
Thank you, teacher.
Thank you. Thank you.
Thank you. Happy New Year.
Happy New Year. Okay. Dr. Minh already xuất hiện vào giờ cuối rồi. Nhưng mà bác sĩ Minh Đỗ sẽ là instructor cho những cái session cuối cùng á, mà mấy session cuối cùng là những cái session rất là hắc búa. You're prepared. Okay.
Có kiểm tra.
Mình có ý kiến gì thêm không? Có dạy ý kiến trước khi mình chấm dứt ở đây?
Dạ chắc không, chỉ có là mấy bạn còn 1/3 lớp thì chắc là toàn những người có quyết tâm thì đó là điều quan trọng nhất. Thực ra không có ai tự nhiên mà giỏi hết, nhưng mà người nào quyết tâm thì người đó đi xa hơn. Thì hy vọng mấy bạn bây giờ thành cái gia đình nhỏ rồi, hy vọng là hỗ trợ nhau rồi mình cứ từ từ mình học thôi, chứ không có gì gấp gáp, nhưng mà nhớ là kiên trì, cái đó quan trọng nhất.
Okay.
Rồi chúc mọi người ăn Tết vui vẻ.
Bye bye. Okay. Happy New Year again. Bye bye.
Chào các thầy, chúc mừng năm mới các thầy và các bạn ạ.
Okay. Bye.